Welcome to the deep dive. Today, our mission is really to decode some of those confusing signals our bodies send us. We're focusing specifically on common ear, nose, and throat conditions.
Right.
We've gone through a whole stack of expert sources, and, well, the goal for you listening is to walk away with some clear, actionable insights. Think of it as a shortcut to understanding these nuances, from spotting subtle symptoms to knowing, when you really need to seek urgent care.
Yeah.
It's all about feeling more informed, more confident, whether it's for you or maybe helping someone else out.
And that confidence is absolutely key. Our sources really hammer home that while lots of these ENT things are just daily annoyances, some can escalate and fast. Learning to spot those subtle differences, it's not just about avoiding confusion. It's really about making sure you take the right action at the right time.
Okay, let's start decoding then. Beginning with those everyday things, the irritants lots of us deal with. First up, allergic rhinitis. What most people just call hay fever, what usually kicks that off, the sneezing and all that. And what's the best way to manage it?
Well, allergic rhinitis, it's typically triggered by the usual suspects: pollen, dust mites, maybe pet dander.
Right.
And while, lots of people grab an antihistamine when they feel it coming on,
Sure.
our sources really stress that for consistent, long-term relief, the big thing is often tackling the underlying inflammation.
Oh, okay.
So that means using intranasal corticosteroids, things like fluticasone, you probably know it as Flonase,
Flonase, yeah.
and using them proactively, not just when symptoms are bad, but regularly. It can actually prevent that big inflammatory response.
That makes sense.
Of course, antihistamines like cetirizine Zyrtec or loratadine Claritin, they're still great for that immediate sort of on-demand relief. And simple things like nasal saline rinses. Incredibly effective, actually, just for physically washing the allergens out.
That's a great point, being proactive versus just reacting when you feel awful. Okay, so sticking with things that can feel kind of similar to allergies, let's talk sinusitis. What's the main driver behind that inflammation, and what symptoms should we look out for?
Right, sinusitis. It's inflammation of the sinuses, and surprisingly often, it actually follows a plain old viral cold.
Oh, really?
Yeah, that initial infection causes swelling, it blocks the sinus drainage paths, mucus gets trapped, and it becomes a good place for, secondary issues. The telltale signs are usually pain or pressure in the face, feeling really congested, and often a reduced sense of smell.
Okay.
For treating it initially, much like allergies, we're focusing on symptom relief. So decongestants, nasal corticosteroids again. But here's a really critical distinction the sources point out. The absolute key insight for sinusitis, and this could save you unnecessary meds, is the 10-day rule. Basically, if your symptoms haven't stuck around or gotten worse after about 10 days, antibiotics are probably not needed. Most sinusitis is viral. It'll clear up on its own. Right.
Viral.
It's only if symptoms really drag on past that 10-day mark or if they suddenly get worse that antibiotics really come into play. And when they are needed, first-line options are usually amoxicillin or maybe amoxicillin clavulanate, augmentin.
That 10-day rule, that's huge. So helpful for people.
Yeah.
Now, our sources really flag something critical here. How sometimes, rarely, a common thing like sinusitis can lead to really serious complications, especially around the eye. This is where knowing the precise differences is just crucial.
Absolutely crucial. When you've got eye swelling with a sinus infection, you have to differentiate orbital cellulitis from preseptal cellulitis. Think the orbital septum. It's like a thin barrier inside your eye socket.
Okay.
Orbital cellulitis is a really serious one. It's infection behind that barrier, deep inside the orbit.
Got it.
And that's a true medical emergency because it can directly threaten your vision, potentially causing vision loss.
Wow.
The red flags are clear. Severe eye pain, obvious swelling, any change in vision, even blurriness or just seeing less well. The eye might look like it's bulging forward. We call that proptosis.
Proptosis, okay.
And critically, pain when you try to move your eye, any of those. That means immediate trip to the emergency department. No delay. Now, contrast that with preseptal cellulitis. This is less severe. It's just infection of the eyelid and the skin in front of that septum barrier. Yeah, so you'll see swelling, redness of the eyelid, and this is key, NO, bulging eye, NO, vision changes, and absolutely NO, pain when moving the eye.
So the bottom line for someone with eye swelling, if there's any vision issue or pain moving the eye, that's the signal. Straight to the ED.
Exactly. That distinction could literally save someone's sight.
Okay, let's pivot now. Another super common one, the sore throat or pharyngitis. Everyone gets it. But how can we reliably tell if it's just, A viral thing or something more like strep throat?
That's a great question because the cause really changes the treatment, doesn't it? So, viral pharyngitis often comes as a package deal. You usually get other cold symptoms with it, like a cough, a runny nose, maybe even pink eye, conjunctivitis.
The whole V thing.
Yeah, think of it as part of that general upper respiratory thing. Now, bacterial pharyngitis, specifically strep throat, that usually hits you suddenly, severe sore throat, real pain swallowing, fever. But the key difference often is NO cough.
No cough is strep.
Typically not.
Right.
And if a doctor looks, they might see severe redness, maybe tiny red spots on the roof of the mouth. Those are palatine petechia, and sometimes white patches or plaques on the tonsils. And just quickly, tonsillitis just means the tonsils themselves are inflamed. Could be viral, could be bacterial, usually presents with that sore throat, trouble swallowing, and yeah, swollen tonsils.
So if strep is suspected, those rapid strep tests or throat cultures, those are the definitive way to know.
Exactly. They're the gold standard for diagnosis.
Yeah.
And for treating confirmed strep throat, which is important, to prevent complications like rheumatic fever.
Right.
The first choice antibiotic is usually penicillin V potassium. Amoxicillin is also a great alternative, especially for kids, because the liquid form is often easier for them.
Makes sense. Okay, from the back of the throat, let's move to the front of the nose. Something almost everyone deals with at some point. A nosebleed, or epistaxis. What are the common types, and what's the first most effective thing to do right away?
Right, nosebleeds. Two main types. The vast majority, like 90%, are anterior nosebleeds. They're way more common, usually less severe. They come from this little cluster of delicate blood vessels right at the front of the nasal septum. It's called the Kieselbach plexus. Then you have posterior nosebleeds, less common, but they tend to be more serious.
Why is that?
They involve bigger blood vessels deeper in the nose, and they often need medical help to stop. But for managing any nosebleed initially, the steps are simple and really effective. First, sit up straight, lean forward just a bit.
Forward, not back.
Definitely forward. Crucial. It stops blood going down your throat, which can make you feel sick. Then, pinch the soft, fleshy part of the nose right above the nostrils, not the bony bridge. Pinch it firmly. And keep that pressure on continuously for a full 10 to 15 minutes. Don't peak.
Okay, 10-15 minutes continuous pressure, that's key. Lots of people probably peak too soon. What if that simple pressure just doesn't cut it? Or someone gets nosebleeds again and again?
Yeah, if direct pressure isn't stopping it after that time, or if nosebleeds are happening frequently, it's definitely time to get it checked out medically. In those situations, things like nasal packing might be needed, where they gently put material in the nose to apply pressure internally.
Okay.
Or they might use topical vasoconstrictors, like oxymetazoline Afrin is a common brand name to help shrink those blood vessels. And critically, if bleeding keeps happening or it's a recurrent problem, it's really important to look for underlying causes. Could be things like high blood pressure that's not well controlled, or even an undiagnosed blood clotting issue.
Right. Important to look deeper. Now, this brings up a really serious point. Some ENT conditions aren't just bad, they're actual medical emergencies. Epiglottitis is one you mentioned. Why is this one so critical? What are those absolute red flags?
Epiglottitis is, and I don't say this lightly, a life-threatening emergency, period.
Wow.
It's a sudden, severe inflammation of the epiglottis. That's the little flap, like a leaf at the base of the tongue that covers your windpipe when you swallow.
Right. Keeps food out of the lungs.
Exactly. When it gets inflamed and swells up, it can rapidly block the airway completely, makes breathing impossible.
Terrifying.
The hallmark signs are incredibly serious. You need to recognize them immediately. High fever, a very severe sore throat.
Yeah.
Often with drooling because swallowing hurts too much.
Drooling, okay.
Obvious difficulty breathing, maybe a high-pitched noise when breathing in. That's called stridor. Signals a tight airway.
Stridor.
And often, the person will instinctively lean forward, maybe rest their hands on their knees, that's a tripod position, trying to open their airway. This is a situation needing immediate airway management by professionals. So immediate ED referral, no hesitation.
And it's just such a stark reminder that this incredibly serious thing is largely preventable now, thanks to the HEENT vaccine in childhood immunizations.
Absolutely. Vaccination has made it much rarer, thankfully.
Okay, finally, let's take a dive into some maybe less commonly understood, but still important oral conditions. Going beyond just cavities, what can our mouths tell us?
Yeah, the mouth can show some interesting things. Let's start with aphthous stomatitis, what we usually just call canker sores.
Canker sores, okay.
Little painful ulcers inside the mouth.
Uh,
Thankfully, they usually clear up on their own in a week or two. Now, don't mix that up with chronic ulcerative stomatitis, much rarer. These are recurrent, really painful ulcers that often don't respond well to standard stuff. They often need systemic meds like hydroxychloroquine, Plaquenil, because it points to a different kind of immune thing going on. Then there's geographic tongue. That's kind of weird, maybe.
yeah.
It's totally benign, though. Your tongue gets these map-like patches because some of the little bumps, the papillae, wear away temporarily, might cause a little discomfort, maybe sensitivity to spicy foods, but it's harmless. Usually no treatment needed, maybe just avoiding irritants or topical steroid if it's really bothersome.
Okay.
Next, leukoplakia. This is important. These are white patches inside the mouth on the gums or cheeks, and the key thing, you cannot scrape them off.
Cannot scrape off, got it.
Right. While they can be benign, it's crucial to know they can be a sign of oral cancer, so they absolutely need monitoring by a dentist or doctor. Related but different is oral hairy leukoplakia. This usually shows up on the sides of the tongue.
Okay.
It looks kind of white and, well, hairy or feathery. This one's linked to the Epstein-Barr virus, EBV, and you usually see it in people with weakened immune systems, especially with HIV or AIDS. But the good news with this one, despite the name and appearance, it's not considered precancerous.
Okay, that's a relief.
Finally, oral candidiasis or thrush.
Thrush, right.
These are also white patches, often creamy looking. But unlike leukoplakia, these can be easily scraped off.
Can scrape off.
Yes, and usually underneath you'll see red, maybe slightly bleeding, inflamed tissue. You often see it in immunocompromised patients, maybe during chemo, or in people using inhaled corticosteroids for asthma if they don't rinse their mouth afterward.
Right, the inhalers.
Treatment is antifungals, nystatin, swish and swallow, or maybe fluconazole pills. And for the inhaler users, simply rinsing with water after each puff helps prevent it.
So that ability to scrape, or not scrape, the white patch off, is the absolute key difference between thrush, which is treatable fungus, and leukoplakia, which needs watching for cancer risk.
Exactly. That's a really crucial visual clue.
Wow, what an incredibly useful journey through all that. Decoding these signals from our ears, nose, throat, even our mouths, from figuring out when allergies might actually be sinusitis to spotting those life-saving red flags for epiglottitis. We've definitely unpacked some vital distinctions today.
Yeah.
And hopefully, for everyone listening, this deep dive really shows the value of having this knowledge. Knowing these subtle differences, recognizing the red flags, knowing those first steps, it can make such a difference in getting the right care at the right time. For you, or maybe for someone you love.
It really can. And maybe, beyond just spotting symptoms, I'd leave you with this thought to chew on.
Okay.
How might actually understanding the why behind these conditions, the mechanisms, empower us? Empower us to ask better questions when we see our doctor, communicate more clearly, and just be better advocates for our own health.
That's a fantastic question, something really important to think about. Thank you for joining us on this deep dive.